And you might say, well, let's suppose we take half of it out of calories in and half of it from more calories out. The balls around this chart are just 5 examples of individual things that you could do, each of which is worth 250 calories. So if you can imagine doing one of these kinds of things, and there are only 5 up here, but there are literally dozens, and the trick is find ones that work for you. So, I mean, hopefully there's no one from Starbucks in the room, but one less cafe latte, 250 calories fewer. If you like salad dressings low cal instead of full calorie, that's 250 calories per serving. If you like sodas, go to diet rather than a regular at the rate of 2 per day, that's 250, and so on. On the calories outside, here are 5 different ways you could increase calorie expenditure by 1,750. A lot of us have offices with doors that close. If you're standing up, you burn twice as many calories as when you sit down. If you're pacing, you'll double it again. So get a headset or turn on the speakerphone, take your phone calls on the hoof. That, if you can do that for, all of us work Saturdays anyway, if you can do that for an hour a day, 6 days a week, that's 1,750. Circuit training and so on. My absolute favorite is down on the left. If you spend a little more than an hour a day, 7 days a week, pushing a cart around a Safeway store, you will burn 1,750 calories more. That will not work in Walmart, though. That's only in a Safeway. Transparency. The bars here indicate the range of costs that we Safeway have paid, and I say we, a combination of us and our employees, in the greater San Francisco area between 2006 and 2008 for various services. Colonoscopies, we've gotten a colonoscopy for anywhere from $900 to $8,650. Now, I was talking to one group, and he queried me, and he said, you know, how do you know the guy who's doing it for $900 doesn't have a technique that involves a flashlight and a garden hose? And the answer is that you ask your health plan to make sure that these are good quality providers, and they have evidence of that. Hernia repair, $3,500 to $17,000, 4 to 1. So on and so forth. I've run these numbers for San Francisco, I've run them for Seattle, for Phoenix, for Denver, for Portland, Oregon, and the pattern is the same. I just want to show you one in detail. Don't expect you to be able to read this chart, but these are the providers our people have gone to in the greater San Francisco area for colonoscopies in the last 3 years. You can see 887 on the left and 8,650. What I would encourage you to take a look at is the height of the various colored sub-pieces of the bars. The professional services fees are purple. You can see those don't vary enormously from high to low. That's not where the cost difference comes from. The orange portion is the room rate. It's the hotel charge. The guy on the right is getting $3,600 an hour for his operating suite. I'd like to have that business, but I don't want to send anybody there. We now have dealt with this with a technique called reference pricing, which, because under our plan, colonoscopies is a preventive measure. It's something, therefore, that we pay 100% of. So we do not ask for any cost sharing. But we've decided we don't want to pay $8,600 if you can get a good procedure done for a lot less. So we asked our partner, who happens to be Cigna, say, look at the data, look at your data, tell us, and this was for a 7-county area in Northern California, tell us the price point at which anybody in that market who works for us can get a colonoscopy of good quality, according to your data, by not having to drive more than 30 minutes. Because we thought, this is something you have twice in your employed life, right? You have one at 50 and 60. It's not unreasonable to ask you to do a little research and to drive 30 miles. The answer was $1,500. So we've now capped this. And we now say that we pay the full cost of a colonoscopy up to and including $1,500. If you want, and we now provide information on where you can go to find colonoscopies at various costs. If you want a more expensive one, we say that's your choice, but you pay the full incremental amount out of your pocket, and it does not, and that extra does not get credited against your out-of-pocket limit. So it's really out of your pocket. It may not surprise you to know that year to date in Northern California, we have not had any colonoscopies over $1,500. When you create a plan that is designed so that it encourages consumerism and it makes a difference to people what choice they make, they will make smarter choices. The problem, of course, is that this information is not readily available to members. It's not even readily available on some health plan websites. And you might ask yourself, why do we tolerate this? I'd like to suggest a metaphor to you. Imagine a grocery store that has no price tags on the shelves. You go in, you want a box of Raisin Bran. You go down the cereal aisle and you see there are 4 choices. You can get Kellogg's, Post, Kashi, or private label. No prices. Someone told you that one of those might cost 10 times what the next one does, but you don't know which. You fill your cart. You have the same experience in frozen foods, in produce, in meat, in delicatessen, bakery, even in floral. Your cart is full. You go through checkout. You hand over your Visa debit card. The clerk checks you out but does not give you a receipt. 3 weeks later, you get your Visa statement, and you realize you spent $250, but your employer paid $200 of that. And your only thought is, geez, maybe I should have bought more wine. That's retail healthcare. Now, I submit to you that none of us would voluntarily shop in such a grocery store. I mean, in the words of the inimitable Tony Soprano, we'd say, get out of here. We wouldn't tolerate it, but we tolerate it. It's the only system we have in retail healthcare. We think we have to break that paradigm, that we have to provide insight to relative price and value, and we have to have plans that make a difference to a person's wallet as to what they choose. Here are the basic elements of our health plan. I won't read them all to you, but I would just say that all of our preventive stuff is fully covered, and I attract your attention particularly to the ones that are in yellow, because I think these are the ones that are relatively unique to us, or more unique to us, and we think very important. We have behavior incentives. We have a wonderful new program called Care Connect, and where is Stephanie? I spoke to Stephanie before, from the UC Davis Health System. They're part of this. Essentially what we do now is we have a hotline that's orchestrated for us by UCSF, and any one of our employees or immediate family members anywhere in the United States, that's probably 350 to 400,000 people, if diagnosed with breast or prostate cancer, we say, call this 800 number. We'll help you get seen for a second opinion by a best practice provider in your geography. So, for example, a food clerk in Houston is going to get directed to MD Anderson. This is very important. If you're a woman and you're diagnosed with breast cancer in this country, and if chemo is one of the treatment regimens, only 30% of the time do you get the right chemo in the right dose. Another 30% of the time you get the right chemo, you get the wrong chemo, and about 40% of the time you get the right chemo in the wrong dose. And both of those last 2 categories have really lousy outcomes. You have a very bad time, you may die, and the costs are very high. The point is that breast cancer and all cancers are highly specialized fields. You want to be seen by a best practice provider, and that's what Care Connect does. It helps our entire workforce. We've talked about transparencies. I've talked about reference pricing. Pharmacy side, we aggressively motivate people to go to not only generics but to therapeutic alternatives. That means, if you think of that, if you're on a statin, think simvastatin instead of Lipitor. Not the same chemistry, but the same therapeutic outcome for about 90% of patients. We have weight management. We talked about cancer research fundraising. We formed the Coalition to Advance Healthcare Reform. Over 60 companies were advocating together, and we're a co-founder of the Healthy Weight Commitment Foundation. We and PepsiCo founded that. We now have 40+ companies involved in this effort to work in the workplace, in schools, and with consumers through improved product formulations. We have partnered with the Robert Wood Johnson Foundation that is going to be evaluating our progress here. Healthcare reform. We believe that there are 3 critical elements that need to be there, and some sub-ones. We need to have something close to an individual mandate that gets us universal coverage. There are some things in all the plans out there that are supportive of that. The exchanges are a good concept in our view. Subsidies for low-income individuals is essential if you're going to want to have everybody in.